Let's also tell you that the United Nations Children's Fund, UNICEF Nigeria, is sounding the alarm about the urgent need for widespread vaccination against diphtheria. This comes amid the most severe diphtheria outbreak in recent global history. UNICEF, in a statement, said the outbreak has so far resulted in over 11,500 suspected cases, more than 7,000 confirmed cases, and claimed the lives of 453 people, mostly children. Most cases are children aged between 4 and 15 years who have not received even a single dose of the vital vaccine, laying bare the urgency of the vaccination situation in Nigeria. Similarly, the president of the Nigerian Medical Association, Dr. Uche Ojinmah, urged the federal government to put in place a systematic pattern of prevention and action to curb disease outbreaks in the country. Joining me on the news to discuss this further is Dr. Adefolarin Opawoye. He is an infectious diseases consultant, Lagos University Teaching Hospital, and public relations officer, Nigerian Infectious Diseases Society. Thank you so much, Dr. Adefolarin, for joining us.
Thank you very much. Great being here.
So we see 11,500 suspected cases, 7,000 confirmed cases, and 453 deaths, mostly children. Diphtheria seems to be gaining ground in Nigeria, but then when you look at other countries, it seems not to be so. So what could possibly be the reasons why we see the prevalence in Nigeria, most especially in the northern part of the country?
Okay, thank you very much. So basically, those are really frightening numbers, and all those numbers are not just dots on the paper. They are lives of children gone, and lives of family changed forever because of something that is extremely preventable. So when we're talking about the reasons for this, it's not so far removed from the fact that we have very poor vaccination coverage in the country. Many of our children are not vaccinated. You had it about 2.2 million children have not even received any dose of these life-saving vaccines, and that's why you have this situation very prevalent, because the northern part of the country has a lot of problem with vaccine hesitancy, where they are not getting vaccines. Also, don't forget the impact of insecurity in some of these areas where the workers are not able to go there because of the disruption of their daily lives. So these are some of the factors, and also just because we are looking for it. Sometimes in medicine, when you look for something, you find it. So all those factors put together be responsible for the very high prevalence. But it's actually quite worrisome, and we hope that something will be done about this in the shortest possible time.
Yes, talking about what can be done, as advocated by the Nigerian Medical Association president, what systematic pattern can be put in place for prevention, and what are the actions that can be exerted to curb disease outbreaks in the country, irrespective of whatever logistical or situational challenge that may be pre-existing in the country?
The question you asked is very difficult to answer, because that irrespective is just totally nullifies it. Health doesn't exist in a vacuum. It's not in a silo. You work with everybody. So for example, we have what we call the One Health approach in public health, where the Ministry of Health is working with the Ministry of Agri, and work with the Ministry of Environment. You can't do this alone. So, for example, you try and deal with a disease like cholera, and then cholera is transmitted by bad water, bad food, and all that. I mean, you need good water resources. You need to work with the Ministry of Water Resources, you understand, to be able to provide safe drinking water for people. So these logistics are very, very important. All these are challenges to actually being able to execute a very successful health plan, because you can't work alone. You need the cooperation of everybody to be able to do it. But when you're talking about diphtheria specifically, it's more of something that we can focus on surveillance, which means quickly identifying cases, tracing contacts, and that helps, prompt treatment of cases. You isolate them, make sure that they don't transfer it to other people. But most importantly is the vaccination. If you vaccinate these children, they are going to be protected from it. What is happening is that for some time now, we have been falling behind on our vaccination rates. And now we are losing what we call herd immunity, which is what protects us against these things. And that's why this place that previously controlled, they are coming back, and coming back with a vengeance. We need to focus on our vaccination. We can do that. Some of these things will be easier taken care of.
So what about those who are actually averse to being vaccinated against these diseases? Because we know there are some cultural practices that may not want to encourage, or that may inhibit people from accessing medical facilities or medical practitioners to receive these vaccines. So when we have these inhibitions, what can be done? That's one. Then two, earlier on you said that it's being transmitted through dirty water baths, as the case is. So for safe practices within people in the community or households, how can they prevent or minimize the spread?
Okay, so I'll start from that. I wasn't talking about diphtheria when I was talking about spread by water. I was giving an example of cholera, trying to illustrate the fact that the health is not something you deal in silos. There are so many social determinants of health that are actually even more important than the disease itself. Diphtheria is transmitted through contact with respiratory droplets. You understand? People breathe in air from someone who has diphtheria, and then they are high risk of getting, and then through close contact. And so what we try to do for to stop the spread of diphtheria is to quickly isolate cases. So that's done by surveillance. Once you pick up a case in a particular area, you quickly isolate, take out that person so that that person doesn't spread it, and then you put the others in that area on what we call prophylactic antibiotics. So you give them some drugs to prevent them from developing the disease. So that's what we try to do concerning diphtheria. I don't know if we could have your first question again.
Yes, what I said was that aside the issue of uh, uh, bad water, what about safe practices at home within families, households, and
Okay.
communities to prevent or minimize the
Yeah.
spread?
Okay, so basically, like I said, you try to quickly identify cases, take them to seek proper health care as soon as possible, isolate them from others. Sometimes we are advised to, when people have symptoms like fever, sore throat, you have a cough, you should start using a mask. And then other people in the house use a mask. It could also help. But initially you were asking questions about what we can do concerning social cultural beliefs about vaccination. And that's really a big problem where we have to really appeal to people. You have to sensitize them, educate them, tell them that these vaccines are safe. People do not trust the vaccines in some areas. There have been also some rumors that these vaccines are used for population control, that they are used to ensure that women are infertile and all that. There are a lot of theories. And these things have been debunked time and time again. But then some of these things, once they hit the population, it's very difficult for you to get them out. And so we have to appeal to them, because really the only way we can deal with this is by vaccination. That's the cheapest way, that's the best way, that's the way we can prevent it from happening. Trying to isolate cases, trying to treat is just really medicine after death. The best thing is to vaccinate, and that's one thing we have to work on. That's the challenge.
Dr. Adefolarin Opawoye, thank you so much for educating us on the news.
Thank you very much.